Hello, Dr. Page and Dr. Eamon. I have come here today to ask you a couple of questions on OCD. You see, my son has just been diagnosed with it, and I'm not very sure what I have to prepare myself for. Well, you see, Cindy, OCD is not a life-threatening disease, and there are several ways that you can help your son suppress his disorder.
What are some of the symptoms your son?
Well, he's had a lot of mood swings lately, and he's constantly worrying.
Yes, these are all normal behaviors. Has he seemed depressed at all?
Well, he never really was a happy child when he was younger. I mean, don't get me wrong, he had his happy moments, but for the most part, he was very anxious and emotionally unstable when growing up.
And what are some of his compulsive acts that he has exhibited recently?
Well, he has his moments where he gets really bad. My first question is, how did this all begin? Is it hereditary or genetic, or did he develop something on his own?
Despite considerable research into the possible causes of OCD, no clear answer has emerged. As with most psychiatric conditions, different factors may be involved. At the present time, the most we can say is that OCD appears to be caused by a combination of psychological and biological factors. In certain individuals, OCD could be triggered by a combination of genetic, neurological, behavioral, cognitive, and environmental factors. Abnormalities or an imbalance in the neurotransmitter or brain chemical serotonin could be to blame as well. The development of OCD, however, is different. The behavioral theory suggests that people with OCD associate certain objects or situations with fear, and that they learn to avoid the things they fear or to perform rituals that help reduce the fear. This pattern of fear and avoidance ritual may begin when people are under periods of high emotional stress. At such times, we are more vulnerable to fear and anxiety. Often, things once regarded as neutral may begin to bring on feelings of fear. For example, a person who has always been able to use public toilets may, when under stress, make a connection between the toilet seat and a fear of catching an illness. Once a connection between an object and the feeling of fear becomes established, people with OCD avoid the things they fear rather than confront or tolerate the fear. For instance, the person who fears catching an illness from public toilets will avoid using them. When forced to use a public toilet, he or she will perform elaborate cleaning rituals such as cleaning the toilet seat, cleaning the door handles of the cubicle, or following a detailed washing procedure that they follow for many other tasks. Because these actions temporarily reduce the level of fear, the fear is never challenged and dealt with, and the behavior is reinforced. The association of fear may spread to other objects such as public sinks and showers.
Have you thought of medicating him? Do you think it would help?
Well, anxiety drug is a medication used to treat obsessive compulsive disorder, which is also the same drug used to treat most anxiety disorders. You could also try psychotherapy. Another important aspect of the treatment and generally recommended in conjunction with the medication use. The medication used to treat OCD generally includes Zoloft, Paxil, Prozac, Luvox, and anafranline. These psychiatric medicines can control compulsive and obsessive thoughts. They work by increasing the level of serotonin in your brain, which is generally low suffers of OCD. There are a risk of medication side effects though, such possible as vomiting, diarrhea, loss of coordination, shaking, abnormal urination, vision change, extreme confusion, stiff muscles, appetite loss, loss of sex drive, and more are all possible side effects of these medications. If you experience any of these symptoms, call your doctor right away. Rapid heartbeat, breathing problems, vomiting, nausea, shakiness, seizures, extreme drowsiness, and low blood pressure can all occur if you've overdosed on any anti-anxiety medication. If you start to experience any of these symptoms, contact a medical provider or call 911 right away. Depression often occurs with OCD, which is why part of the treatment plan involves psychotherapy. Most of the anti-anxiety medication used to treat OCD are suitable for treating depression as well. Behavioral therapy is another option. People with OCD learn to confront and reduce their anxiety without practicing avoidance or ritual behavior. When they learn to directly confront their fears, they become less afraid.
These books aren't alphabetically ordered. Oh no, what have I done? These books are not in order.
Excuse me, young man, what are you doing?
Oh, well, your books, they're not in order. I can't handle it.
Carl, put those books back in order.
But I don't want to. You don't understand. It's the way I am. They're not in order.
I'm sorry, sir. It's my son. He has OCD. It's not his fault.
It's okay. No harm, no foul.